I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. Here with Maria Marzella Sully, a national spokesperson for the American Pharmacists Association and an associate clinical professor at St. John's University. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Today, we're focusing on mental health, a topic that may be of interest to many of our WebMD users. We'll cover the side effects and interactions of various mental health medications and good mental health. My 9-year-old son was recently prescribed Focalin XR 5 milligrams and is currently on allergy medication Clarinex ReadyTabs 5 milligrams. Can he continue to take his allergy medicine while on the new medication now?
I always encourage my patients to use one pharmacy and to know their pharmacist so that the pharmacist can really help them and be aware of all the medications that they're using and screen for all potential drug interactions. We really need to know all of the prescription medications that someone is taking, as well as all of their over-the-counter medications, vitamins, minerals, herbal supplements. Really anything that they use on a regular basis helps the pharmacist do their job and take the best care of the person. That being said, Focalin and Clarinex ReadyTabs are perfectly okay to be taken together. There aren't any drug interactions to be worried about here.
Okay. Are there any interactions if I take Trazodone at night to go to sleep and I take Norco during the day for pain?
Well, there's not exactly drug-drug interactions between Trazodone and Norco. However, both of the medications can make you quite drowsy. Trazodone, although it's an antidepressant medication, it does cause a lot of drowsiness, and sometimes people do use it to help them sleep at night. Taking Norco during the day, which is a pain medication, also can cause some drowsiness. So the one thing I would want this person to look out for is if during the day they're still a little drowsy, sort of like a hangover effect from the Trazodone, which sometimes occurs when people take sleeping pills at night, that if they combine that with the Norco, it may make them extra drowsy. And I'd want to see how this person reacts to the combination of the two medications before they do anything that requires mental alertness, like driving a car or operating heavy machinery.
Okay. Is it all right to take Lyrica and Cymbalta together for fibromyalgia?
It is okay to take Lyrica and Cymbalta together for fibromyalgia. There aren't any drug interactions directly, anything significant that could cause problems. They do have similar side effect profiles, though. Both of those medications have drowsiness and dizziness as one of their side effects, so I would just caution this patient to see how they feel while taking these two medications, because both of them may make them drowsy, and they should check to see how they feel before they do anything that requires alertness, like driving a car.
Okay. About 2 weeks ago, I was prescribed Ambien to help me sleep, and then after seeing my psychiatrist, I was prescribed Celexa on top of that. Both are prescribed for me to be taken at night, but I've read about moderate to serious dangers with the two drugs. Is it okay for me to take them both at the same time, or should I offset the medications by time of day or by hour?
Celexa is an antidepressant medication. It could be taken any time of day, so it's okay if they don't feel comfortable taking it at the same time as the Ambien to take the Celexa during the day and take the Ambien at night to sleep. Although, if it's easier for them to remember to take them both together, there's no real harm in doing so. Ambien, you can't really change the time of day that you take Ambien because it's a sleeping pill, and you always want to take it about 30 minutes before you're ready to go to sleep so that it can do its job and help you sleep through the night. There aren't really any direct drug-drug interactions between these two medications, so I would say for this person to talk to their pharmacist who can help them design a regimen for the day that would work best for them.
Okay. Is there a danger in taking Celebrex and Baclofen?
No, there's no danger in taking those two medications. There aren't any drug interactions reported between the two.
Okay. My 8-year-old son is prescribed Focalin XR, and I would like to know if it is an amphetamine.
Focalin XR contains a medication called desmethylphenidate. It is related to the class of medications known as the amphetamines, but it's not exactly an amphetamine. It is closely related, however. It's also closely related to the medication methylphenidate, which is marketed under the brand name of Ritalin, and that medication is also commonly used for ADHD. These medications help stimulate a part of the brain that helps a child with ADHD focus better. So although it is related to the amphetamines, it's a much milder form of an amphetamine.
What are the side effects of Zoloft?
Zoloft has many side effects, like any medication. There are some common side effects and some signs of more severe side effects that we want patients to look out for when taking the medication. Most commonly, people complain of gastrointestinal side effects, stomach problems, things like nausea, vomiting, diarrhea, and constipation. Some people actually end up with diarrhea from the medication. Some people can actually go in the other direction and end up with constipation. It also can cause drowsiness in some people and insomnia in some other people. So I always tell my patients if there's anything new, different, or unusual that they're experiencing when they start a new medication, that they talk to their pharmacist about it. You shouldn't ever stop a medication because you think it's causing a side effect without checking with your healthcare provider first.
Is it safe to take trazodone and clonazepam together?
There's no direct drug-drug interactions between the two medications, but they do have similar side effects. Both trazodone and clonazepam can cause drowsiness and dizziness, so I would caution anybody using the combination of the two medications to watch out for drowsiness and see how they feel on the medications before they do anything that requires them to be alert and awake.
Okay. I would like to know if there are any medications to treat depression that come in a patch or lotion form if you can't take pills.
Well, my first question for this patient would be, why can't they take pills? Some people do have a hard time swallowing pills, and there are alternative dosage forms of antidepressant medications that could be an option for them. With regard to the patch that they're asking about, there is one medication that's approved for depression called Emsam, which contains the active ingredient selegiline. That is available as a patch to treat depression. There's also several of the antidepressants that are commonly used available in liquid form. So if they can't swallow a pill, it might be easier for them to take a liquid form of the medication, and that increases their options because there is only the one patch form of antidepressant.
Can Nuvigil cause severe dry mouth?
I'm not aware of severe dry mouth listed as a common side effect of Nuvigil. It is a medication that's a stimulant. It helps people stay awake and stay focused, and it can cause insomnia, but I'm not really aware of anybody experiencing severe dry mouth.
I take Celexa and Wellbutrin. Can I take an over-the-counter allergy medication like Sudafed? I have postnasal drip that is causing a sore throat and a cough.
Well, there's a few issues going on here, and I'd really like to talk to this person to ask them some questions and find out some more information. First off, they talk about Sudafed being an allergy medication. Sudafed really is a decongestant. It helps combat congestion, not really allergies per se. Sometimes congestion is a symptom of allergies, but it doesn't directly treat allergies. The other thing that comes up is the fact that they talk about a postnasal drip that's causing a sore throat. So in this case, based on just those symptoms, without knowing anything else that's going on, I would say that an antihistamine is probably their best choice to treat the postnasal drip. Something like chlorpheniramine or diphenhydramine would probably be the best thing to help dry up their postnasal drip. They can also try something like acetaminophen, which would help with their sore throat pain. Neither the antihistamines or acetaminophen would interact with their Celexa or their Wellbutrin. But I would suggest, just because the pharmacist would want to know some more information about this person's condition, that they talk to their pharmacist who can ask them some more questions and collect some more information and help them find the right medication for their symptoms that doesn't interact with their medications.
Okay. I take Zoloft. Is it okay if I take Theraflu for my cold?
Theraflu does have several formulations. There's not just one Theraflu. There's a few different formulas. The one thing I would want somebody who's taking Zoloft to avoid over-the-counter is dextromethorphan, which is a cough suppressant. Not sure if this person has a cough, but anybody who's taking an antidepressant like Zoloft should really avoid over-the-counter medications that contain dextromethorphan, because it does put them at risk for increasing the levels of serotonin in their body, which is how Zoloft works, and it could cause some adverse effects.
Okay. I currently take Wellbutrin XL for depression. I saw a new doctor and she prescribed Wellbutrin SR. Is there a difference between the two?
There is a difference between the two. Both of them are sustained release preparations of bupropion, so they both contain the same active ingredient, but the XL version of bupropion is designed to be taken once a day, whereas the SR version, although it's sustained release, it's a twice-a-day formulation. So I would double-check with the prescriber to make sure that they're aware that that's the difference between the two medications and make sure that they're dosed appropriately.
How long does it take for Lexapro to take effect?
One of the sort of frustrating things a lot of people with depression encounter is the fact that it could take weeks for their antidepressant to really start to work. Up to 4 to 8 weeks, actually. So it's very important to continue taking the medication regularly. And I always talk to my patients when they're picking up a new prescription for an antidepressant about that expectation. A lot of times people are used to taking a medication and the effects kicking in relatively quickly. Days, even a couple of hours or minutes in some cases. But with antidepressants, because of the chemistry in the brain that it's treating, it could take up to 4 weeks before you start to feel better on the medication. In the meantime, unfortunately, sometimes people do experience side effects. So if they get a side effect from the medication and then put together the fact that they're really not feeling as good as they'd hoped as quickly as they wanted without knowing what to expect, a lot of times they give up on the medication and stop taking it. And you really don't want to do that. Depression is something that can be treated in a lot of people, and sticking with the medication can help them get the benefits that they need, but they need to know that they need to give it time to work. 4 to 8 weeks. And if they notice anything different in the meantime, that it's perfectly okay for them to talk to their pharmacist or their healthcare professional about that.
My doctor prescribed Prozac for me. I was wondering if it comes in only a capsule or if it comes in a pill. I have a hard time swallowing pills.
Prozac, which contains fluoxetine, does come in several dosage forms. It comes in a capsule, it's available as a tablet, and it also comes as a liquid. So anybody who's having difficulty swallowing pills, I would usually suggest that we talk to their doctor and get a prescription for the liquid form, because a lot of people don't realize that these medications come in liquid form and that it's perfectly acceptable for an adult to take them if they can't swallow pills.
Okay. Can I take Abilify with other medications like Cymbalta and Xanax?
Yes, it's okay to take Abilify with Cymbalta and Xanax. There aren't any direct drug-drug interactions between the three. However, some of them have similar side effect profiles. Abilify and Xanax can both cause drowsiness and dizziness, so I would want to make sure that this person sees how they feel while taking these three medications before doing anything that requires mental alertness. Their pharmacist will screen for drug-drug interactions when they present a prescription to them, so as long as they're using one pharmacy and their pharmacist knows about all the medications that they're using, the pharmacist should be screening for these drug interactions and would discuss any of these concerns with the patient when they pick up their prescription.
Okay. Will Prozac 40 milligrams react in a bad way with Phentermine 18.75 milligrams?
It's not that they would react in a bad way, but they do cause similar side effects. Phentermine has an appetite-suppressing effect, which is why we use it as a diet aid. However, it can increase heart rate and increase blood pressure and have somewhat of a stimulating effect. In some people, Prozac also causes insomnia, which, combining the two medications, I would say if this person finds that they're having difficulty falling asleep at night, that they talk to their healthcare provider, because it may be due to the combination of the two medications, and that's something I'd want them to watch out for.
Okay. Can I take Tylenol if I'm taking Buspar and Ritalin? I have a fever.
Yes, it's okay to take Tylenol with Buspar and Ritalin. Of course, I'd always suggest that anybody who wants to take an over-the-counter medication, if they're taking prescription medications, that they talk to their pharmacist first. Their pharmacist can help determine which over-the-counter medication is the best one for whatever it is they're experiencing, as well as screen for any potential drug interactions. In this case, Tylenol is okay to use with Buspar and Ritalin.
All right. Does the drug Buspar affect in any way blood glucose levels?
No. Blood glucose levels are not normally affected by the medication Buspar, but if they have any questions about that, they should talk to their pharmacist.
Mm-hmm. My husband is bipolar. His mental health doctor put him on Zyprexa, but there was a mix-up. He was discontinued from Zyprexa, which was helping tremendously, and put on Seroquel, which does him no good at all. Is there a generic form we can ask his doctor about?
There is no generic form of either Seroquel or Zyprexa. In this case, I would want to talk to this patient a little bit more and find out what exactly is going on. But if they're unhappy or they're noticing some difference in the way their illness is being treated on the Seroquel and the Zyprexa was working for them, I would want to know why exactly the switch was made. I'm not sure what they mean by the fact that they say there was a mix-up. If Zyprexa was working well for them and they're unhappy with their new medication, they should talk to the healthcare provider that prescribed it and let them know that the Zyprexa was working better for them, because there might be some way to substitute the Zyprexa for the Seroquel, and they might get better results with that.
What's the difference between Prozac and Zoloft? Is one safer?
Prozac and Zoloft both belong to the same class of medications known as the SSRIs, which stands for the Selective Serotonin Reuptake Inhibitors. They work on the same chemical in the brain to treat depression. As far as the safety is concerned, everybody responds a little bit differently. In some patients, Prozac might be the drug of choice for them, and in other patients, Zoloft might be the drug of choice for them. It's important to have alternatives within classes of medications because not everybody responds exactly the same to the same medication. In this case, this person should talk to their doctor, and their doctor can help determine which antidepressant is the right one for them.
Okay. Is it okay to take Trazodone and Bupropion SR together?
Yes, it's okay to take those two medications. Trazodone is an antidepressant medication. I would imagine that this person was prescribed bupropion to help them quit smoking.
What are the side effects of Paxil?
Paxil has several side effects. Much like any of the antidepressant medications, it has the potential to cause drowsiness, although some people do report insomnia from this class of medications. Since everyone reacts differently, it's important to see how you feel on the medication and talk about any side effect or anything new or different that you experience when you first start taking the medication. Other common side effects include things like nausea, vomiting, and diarrhea, as well as sexual dysfunction. That's one of the common side effects of the antidepressant medications, and something a lot of patients are afraid to talk to their pharmacists or their healthcare professionals about. They start to experience it and don't really feel comfortable talking about it. And I would want to encourage anybody who's taking an antidepressant medication, if they experience any sexual side effects, to talk to the healthcare professional about it, because there are things that can be done and changes that can be made to their regimen that might help them overcome those side effects and still be able to manage their depression effectively.
Okay. Can you take Zoloft and cyclobenzaprine at the same time?
You can. Zoloft is an antidepressant medication that's used for a lot of different reasons, and cyclobenzaprine is a muscle relaxant. Cyclobenzaprine can cause some drowsiness, and some patients do report drowsiness with Zoloft as well, so I would just caution the patient to watch out for that. Other than that, the two medications can be taken at the same time, and it's always a good idea to double check with your pharmacist before taking more than one prescription medication together.